so today we're going to be performing an intraoral exam on Miss Katie. Miss Katie, if anything feels uncomfortable to you during the procedure, please let me know. But this is just to get a baseline for what's normal for you. And we're going to be looking at your tissues such as your lips, your hard palate, your soft palate, your tongue. So we will go step by step and we'll document any findings.
Okay, so first thing we're going to do today is look at the lips, and we're going to go ahead and observe them wet.
So this is considered observing them wet, just looking at them naturally.
We're going to go ahead and observe them. We're going to go ahead and dry.
We're going to dry the lips. And go ahead and open, Katie.
And then you're going to observe them dry.
You're taking a piece of gauze and you're basically just blotting the lips. And then you're going to observe them dry for any cracking, any angular cheilitis, anything that you may note that is out of the norm.
And then we'll go ahead and palpate them.
To palpate them, you want to be careful that you do not put saliva on the patient's face, so you may want to dry your fingers. And you're going to do it digitally, so that means using your 2 fingers, and you're going to feel for little BBs or little marbles. And sometimes even in perfect health, you'll feel things like Fordyce granules, which are like little tiny grains of sand. Did you notice though, as I went along, that I didn't get Katie's face wet? I rotated my fingers.
Good. Then we're going to go ahead and move on to the maxillary, the mandibular vestibule, and the alveolar bone.
Okay, so to familiarize everybody with the vestibule is the highest point that your finger can reach, but where the mucobuccal fold is, clear up at the top here, and then clear down at the bottom. The alveolar bone is the actual process that holds the maxillary teeth in and the mandibular teeth. So I'm observing them wet.
After you observe them wet, you want to go ahead and observe them dry.
So the easiest way to observe them dry is to wrap this around your finger and then to go ahead and take it and use it in like a sweeping motion. And then you can do it in quadrants, okay? So when you do that sweeping motion, you can look right away and observe it dry. Observe dry. Observe it dry. And be careful because there are some frenums up here, okay? The maxillary frenums. Just be careful when you're going over that. And then observe it dry, okay?
And then we'll be ready to palpate it separately.
Okay, so the vestibule, the way we palpate is using one single finger. You go up to the height of that mucobuccal fold and you do little circles. And once again, you have to be very cautious with those maxillary frenums. There are some mandibular frenums as well. Some people have more prominent ones than others. And then you just drop down using that same finger, palpating at the base of that mucobuccal fold. To start with the alveolar processes, you're going to start with this one finger and you're going to go to that maxillary tuberosity. That is located right behind the 2nd or 3rd molar if the patient has wisdom teeth, okay? You're going to switch then and you're going to palpate with your bidigital fingers and you're going to go bidigitally the whole way around the maxilla, switching your fingers when it becomes uncomfortable. You're going to end at the other maxillary tuberosity, right behind that 2nd molar for her. We're going to drop down to the bottom. What is behind that last molar? The retromolar pad. So I'm doing the same thing. I'm using my one finger and I'm feeling that retromolar pad. Then I'm putting both fingers in and I'm palpating the alveolar process with little tiny circles. Finishing on the retromolar pad again with my one finger.
Then we're ready to move on to the buccal mucosa.
Okay, so remember when we did the parotid on the outside for her extraoral? The buccal mucosa is going to be basically that same big area on the inside of her cheek, okay? So we're observing it wet. We can do one side at a time or both at the same time. Noting her Stenson's duct. That's where all the saliva production is going to be. She has a nice little Stenson's duct there that we can see. Okay.
Then you'll want to go ahead and observe it dry.
So we're going to hold the gauze over Stenson's duct for at least 5 to 10 seconds. So I'm drying everywhere first, and then I'm going to hold it over that little duct, give it about 5 to 10 seconds, and then you'll be able to see the production of saliva. Everybody's going to love this because it is really a neat phenomenon. So we'll take this off and we'll watch it. And you're looking for the saliva. I'm kind of milking the gland. I saw a big drop of saliva come out, and you're just going to note the consistency, which is clear and thin. Then we're going to do the same exact thing to the other side. I already observed it wet, so I'm just going to go ahead and dry it, and then holding it over Stenson duct for about 30 seconds. And then I'm going to take it off and watch the gland. It produced right away. Once again, a nice big bubble of clear, thin saliva. Perfect.
And then we're ready to palpate.
So to palpate, I'm going to once again make sure my finger is dry, because one finger is going to be on the outside, one's going to be on the inside, okay? You're going to do bidigital, and you're going to do little circles, once again, feeling for something as small as a grain of sand. And you're going to palpate that whole cheek area, coming clear to the area of the angle of the lip there. Okay, then we're going to do the same thing on the other side, just making sure your fingers are dry. Okay.
We're ready to move on to the oral pharynx.
Okay, so the different things that are contained in this piece of the exam are the hard palate. This is where your incisive papilla is, all of the rugae, the maxillary rugae, and you can tell as soon as the hard palate stops, that's when it starts to get soft. That's the part that we're not going to palpate. We're just observing wet, okay? So let's first do the hard palate. We're gonna observe it wet. I'm just basically looking at all the little ridges, her rugae, make sure there's no pizza burn or palatal burn. Then I'm going to dry it. And you notice I picked up my mirror because I could bend over to see it, but is that good for our necks? So now I'm going to observe it dry. Looks good, and I'm going to go ahead and palpate it just using one finger. This can tickle, so you want to make sure you use firm pressure so the patient isn't too ticklish with this. Good, I'll let you go ahead and swallow, Kate. So to observe the oral pharynx, soft palate, tonsillar area, we're going to use our tongue depressor. Like when you go to your PCP and they look at your throat, you just want to be as comfortable as possible with this. Put this on the body of the tongue and have the patient say, ah, observing the uvula, the anterior and posterior palatine tonsils. And yes, very good, Katie. I don't want to make you do that too long. So we want to be quick about that. And we want to be gentle with our tongue depressor. Okay, let's take a break for a minute and we'll come back.